welcome guys to another YouTube video. In this episode, I'm going to do a video about emergency contraceptive pills, right? Or what is known as morning after pills, right? The likes of P2, right? So I'm going to make just a brief video, right, about emergency contraceptive pills, right? Yes. So these are they are basically steroid hormones, right? Others contain estrogen, progesterone. Others contain estrogen alone, right? Yes. So, why would somebody take emergency contraceptive pills? What are the kind of situations, right? For example, you are using oral contraceptive pills, right? The likes of combined oral contraceptive pills or the progestin only pills, right? And in the course of this time, maybe you forgot to take the pills, maybe for 1 or 2 days, right? So in this situation, you can use emergency contraceptive pills when maybe you forgot to use your normal pills, right? Yes. So this is one of the situations. Another situation is maybe the failure of the barrier method. Maybe you're using the condoms, right? Maybe during the sexual intercourse, the condoms busted, right? And now you're worried that you're soon getting pregnant. These are kind of situations you can use emergency contraceptive pills, right? The likes of the P2. Apart from that, maybe you had unprotected sexual intercourse, and then after sex, you realize that you don't want to get pregnant, right? Then you can decide to go for emergency contraceptive pills, right? But again, it's not a guarantee. It's not a guarantee that it's going to prevent you from getting pregnant, right? Yes. So apart from that, maybe another situation that can prompt you to use emergency contraceptive pills is when you had an unconsensual sexual intercourse. Maybe you are raped, right? Maybe you are raped. You are not planning to get pregnant. You don't know the person, right? It's a whole event, right? A whole cascade of processes, right? And you don't want to get pregnant. So when you are raped, maybe you can go for these emergency contraceptive pills and many other uses best known to you, maybe to everybody has a reason for the usage. Those are some of the common reasons why people use emergency contraceptive pills, right? Yes. So we have two major types of emergency contraceptive pills. Two major types. One, we have the copper-bearing intrauterine contraceptive device. We have a type that can be used as emergency contraceptive pills, and the second category is the oral pills. Under the oral emergency pills, we have three categories. We have emergency contraceptive pills that contains levonorgestrel. We have emergency contraceptive pills that contain what we call ulipristal acetate. And finally, we have emergency contraceptive pills that contain both estrogen and progesterone, right? What we call combined emergency oral contraceptives, right? Yes. So we have two broad categories: the one that contain the copper-bearing intrauterine device, and you have the oral pills that has three categories: the one that contain ulipristal acetate, the one that contain levonorgestrel, and the one that contain both estrogen and progesterone, right? Yes. Having mentioned that, so how does they work? How does this emergency pills work, right? So the main mechanism of action is that they delay ovulation, right? We know that without ovulation you cannot conceive, right? So these pills, maybe you decide to use the copper-bearing IUCDs or the pills, the three categories, right? One of the main way which they prevent pregnancy is they delay ovulation. No ovulation, no pregnancy, right? Yes. Apart from that, they cause chemical changes. They cause chemical changes on the sperm. They cause chemical changes on the ovum. That is if you are already ovulated, right? So they can cause chemical changes on the ovum and on the sperm. These chemical changes can inhibit fertilization, right? So if there are chemical change in the sperm, the chemical change on the ovum, the likelihood of fertilization taking place is very unlikely, right? Yes. So apart from that, they also thicken the cervical mucus, right? They make it thick, right? If you use maybe the oral pills, the emergency oral pills, or the copper IUCD, the copper bearing intermittent contraceptive device, they thicken the cervical mucus. With thick cervical mucus, the passage of sperms becomes more difficult, right? The passage of sperm to reach the oviduct becomes more difficult. And that makes fertilization to be very difficult, right? Because if the sperms cannot reach the oviduct, fertilization will not take place, right? Yes. So those are some of the mechanisms. That's the mechanism of action, how they prevent fertilization from taking place. Yes. Many people have asked, can I get pregnant if I use emergency contraceptive pills? The answer is a big yes. Yes, you can get pregnant. You can get pregnant. This is not 100% guarantee that if you use emergency contraceptive pills, you're not going to get pregnant. You can get pregnant. This is the scenario. We have a physiological process called capacitation of sperms, right? So capacitation of sperms takes approximately 3 hours. So capacitation of sperms basically means it's a physiological process that the sperms undergoes that prepares the sperm for fertilization process, right? So for fertilization to take place, the sperms must be prepared well enough for fertilization in a process we call capacitation. And the capacitation takes approximately 3 hours, right? So if capacitation takes approximately 3 hours, and let's say maybe you ovulated maybe the same day, maybe let's say after maybe 5 hours post coitus, right? So that is approximately 8 hours. Capacitation has already taken place. You have already ovulated, right? So the sperm is ready for fertilization, right? And you have already ovulated. And for example, in this situation, you are going, you've taken, you have remembered that you had unprotected intercourse. Maybe you had a failed barrier method. You had a busted condom. Maybe after 2 days, right? You ran to the chemist maybe to get your maybe P2, right? And you decided to take it after 2 days, right? Remember, fertilization, we said that capacitation already took place. That is 3 hours, right? And you already ovulated, right? So that's a combined period of, let's say, 8 hours. And you decided to take your pills after maybe 2 days, right? That cannot help you, right? Fertilization has already taken place. And this pill cannot destroy an already existing embryo, right? Yes. So in this situation, these pills are not going to help you, right? So when should you take oral contraceptive pills? Take them as immediately as you are done with the sexual intercourse. As soon as you are done, take them immediately. That is probably within 24 hours, right? Because I've told you that capacitation must take place. It only takes 3 hours. Ovulation must take place, right? If ovulation has taken place, capacitation has already taken place, fertilization has already occurred, and you decide to take your pills after that period, you are doing absolutely zero work, right? Yes. So when should you take them? Take them as immediately as you can, as soon as you are done with sexual intercourse, right? Yes. Sounds funny, but that's it, right? Yes. So what are the risks? What are the benefits of emergency contraceptive pills? They have the risks. They have also the benefits. One of the main benefits is that they are very effective. They are very effective in preventing unwanted pregnancy. That is when you take them at the right time, right? As immediately as you can, right? Before ovulation has taken place, before capacitation of sperm has taken place, right? So they are very effective in preventing unwanted pregnancy, and again, they don't have your chances of having pregnancy in the future, right? Yes, so they are very effective, and they don't have your chances of getting pregnancy maybe in the coming years, right? Yes, we have side effects. There are very side effects. One, it can cause a delay in your menses, or you can lack your menses for some period of time, or maybe if you are used to getting your menses after maybe let's say 28 days or 26 or 27, they can come early, maybe after 20 days, or they can even come late, right? Yes, so it can disrupt the whole menstrual cycle, right? Yes, so you need some time to adjust post after using this kind of contraceptive pills, right? Again, there are people who have light vaginal bleeding, light spotting. This is some kind of side effects. You can have some spotting, some light vaginal bleeding, right? Yes. So again, they can also increase your chances of having deviant thrombosis, DVT, right? Blood clot in your system, blood clot in your veins, right? They can also increase the chances of this kind of conditions. You have the normal one, you have the breast tenderness. Why? Because you are consuming hormones, you are ingesting hormones, particularly estrogen, right? What happens? It can increase, they can cause changes in your body, the likes of breast tenderness, right? We have the normals, the likes of headache, the likes of maybe bloating, right? So these are kind of side effects that you should be aware of. You should be ready psychologically, right? So that if they happen, they don't take with a big shock, right? Yes. So having mentioned this, the very important thing as far as emergency contraceptive pills is timing, right? There are people who have been asking, right? Why does emergency contraceptive pills fail? Right? We have four reasons. We have four reasons why emergency contraceptive pills fail. The first reason is timing. Timing is very, very key as far as emergency contraceptive pills are concerned. Very, very important. I've already explained. Capacitation must take place. All it is for 3 hours, approximately 3 hours. Ovulation will take place, right? If you've consumed this kind of pills after ovulation, after capacitation, and fertilization already taken place, you are doing absolutely zero work, right? And fertilization already taken place, it cannot destroy an already existing pregnancy, right? Yes. So timing is very, very important. As soon as you are done with the sexual intercourse, you can take it. If you are planning to use it, right? As soon as you are done with the sexual intercourse, right? So the first key factor is timing. Another reason why they fail, maybe vomiting. Vomiting maybe within 2 hours of consuming them, right? The medication we have not been absorbed into the system, right? And you've already vomited, right? So it's not going to work again. Apart from vomiting in these 2 hours, we have obesity, right? Especially emergency contraceptive pills containing levodogestrone. They're not going to work, right? They're rarely going to work in those people who are obese, right? Yes. So that is overweight. Talked about vomiting. I've talked about timing, right? Yes. And also we have interaction with that kind of medication. Maybe you are on barbiturates, right? Interaction of barbiturates and these emergency contraceptive pills can lower their effectivity, right? Yes. So you should be very, very careful of the timing of these pills if sure you don't want to get pregnant, right? And it's not 100% guaranteed that you are going to prevent the pregnancy, right? And they're not going to induce abortion, right? Yes. So timing is very, very key as far as emergency contraceptive pills is concerned, right? So that marks the end of my video for today. I hope you learned something. Continue commenting. Tell me which kind of topic you want us to discuss in the next video, right? I'll be waiting, right? Thank you for the returning subscribers. Thank you for those people who have subscribed. Continue subscribing, continue liking the videos. We'll continue learning more as far as health is concerned. Yes, so thank you for now, and let's meet in the next video.